My name is Jake England. This presentation's topic is dissociative identity disorder similar to schizophrenia. Before we talk about the similarities and differences between these two disorders, let's talk about them individually. Dissociative identity disorder, or DID, is one of several dissociative disorders. Dissociation is defined as a lack of normal integration of thoughts, feelings, and experiences into consciousness and memory. DID is considered the most complex of the dissociative disorders and was formerly known as multiple personality disorder. DID is characterized as having two distinct personality states. Often, one does not realize that they have DID because they go about life functioning at optimal levels, whether it's at home or at work. Even though they have different personalities, whenever the second personality kicks in, they do not remember that experience afterwards. So while they have gaps in their memory, they do not realize at first that they have a second personality. Schizophrenia, on the other hand, is a psychotic disorder. It is also a schizophrenia spectrum disorder. It is generally characterized as having positive symptoms and negative symptoms. In terms of positive symptoms, those include Schneiderian first-rank symptoms, which include delusions, which refer to culturally inappropriate beliefs about external reality that is firmly held by the patient, often in the face of contradicting proof. Hallucinations are also included in this, as well as disorganized speech and grossly disorganized or catatonic behavior. Disorganized behavior is typically considered disorganized if others do not understand it. However, that does not mean that it does not make sense to the schizophrenic, as often it relates to trauma that they have experienced in the past. Negative symptoms of schizophrenia refer to an absence of normal behavior. It includes social withdrawal, apathy, and cognitive impairments. Now, similarities between DID and schizophrenia. They share traumatic antecedents in various forms of childhood abuse. There are also overlapping symptoms between both disorders that studies have found schizophrenia has certain dissociative symptoms and DID has certain schizophrenic symptoms. In terms of their related causes, they are in the form of childhood trauma, which include physical abuse, sexual abuse, emotional abuse, and emotional neglect. While sexual abuse was predominantly found to be the primary means of predicting dissociative symptoms, emotional neglect in another study was found to correlate with higher rates of dissociative symptoms. Similar schizophrenic symptoms that are found in DID patients are mostly positive symptoms, and in those, Schneiderian symptoms. These include auditory hallucinations, thinking that you're hearing something that is in fact imagined, as well as feelings, thoughts, or actions that are intrusive and against the patient's will, which coincides with somatic passivity, which is feeling that an external force is putting or pushing its will onto you in the form of these feelings, thoughts, or actions. Interestingly, a higher reporting of these symptoms is found in DID patients than in schizophrenics. DID symptom similarities that are found in schizophrenic patients include depersonalization, which is an experience in which the patient experiences a sense of unreality and detachment from themselves. Common descriptions of depersonalization include the feeling of watching oneself from a distance, feeling disconnected from one's own thoughts, and feeling emotionally numbed or blunted. Derealization is a mental state where a patient feels detached from reality and people and objects around them seem unreal. In terms of distortions of identity and personality, these are slightly different than what occurs in DID patients. Schizophrenic patients can remember their experiences. However, they recall them as feeling like an identity that was not theirs, controlling their actions and making choices that they would not have made. Oftentimes, the schizophrenia patient uh, believed in that moment that they are another person or they are doing something that is not real. Dissociation amnesic episodes are also another symptom of DID that can be found in schizophrenic patients. One study concluded that dissociative processes could lead to symptoms found in schizophrenia. Now, there are also parts where schizophrenia and DID differ in the areas where their symptoms overlap. These include differences in the experiences that each disorder feels in regards to the symptoms and differing rates of dissociative and psychotic symptoms themselves. In terms of the symptom differences, auditory hallucinations are a primary example. Schizophrenic patients report them as being external or hearing them outside their body, where DID patients report them as being internal and hearing the voices inside their body. With the DID patients, this is often experienced as their multiple personalities conversing with each other. There are also different intensities of symptoms between the disorders. In regards to dissociation symptoms, schizophrenic patients often experience these with none to mild to moderate severity, where DID patients experience those symptoms with moderate to severe intensity. As have already been shown, depersonalization and derealization have differing effects in schizophrenia patients versus DID patients. In terms of differing rates of symptoms, they are mainly, a primary example is in regards to dissociative symptoms. Patients diagnosed with a schizophrenia spectrum disorder show pathological levels lower than DID patients, with varying percentages in regards to dissociative amnesia, depersonalization, derealization, identity confusion, and identity alteration. While these are differing in percentages, none of them are above 50%, with the exception of identity alteration, which is just above. In terms of psychotic symptoms, auditory hallucinations actually occur more frequently in DID patients and in more than 70% of DID patients total. Two studies found that 45% in one study, or in the other study, 2/3 of DID patients are reported to have delusions. Well, this is a significant amount in terms of schizophrenia patients who have delusions as a common symptom. These odds do not stack up as relating or being comparable in terms of similar rate. Due to these similarities, it has led to diagnostic confusion between schizophrenia and DID, which has caused many misdiagnoses of schizophrenia to be given to those with DID. Many patients who were later discovered to have DID or diagnosed with DID were first diagnosed with schizophrenia beforehand. One reason for this could be that according to the DSM, the Diagnostic and Statistical Manual of Mental Disorders, if it has only one symptom present and it is auditory hallucinations, then the person prescribing the diagnosis would conclude that that person has a psychotic disorder. If they have other symptoms in addition to that, one of which is delusions, then the DSM would conclude that that patient is schizophrenic. However, as we have seen, these symptoms are also in DID patients, and that could lead to a misdiagnosis. There have been proposed solutions for correct diagnoses, however, to not make false diagnoses, and those include studying different direct comparisons between DID patients and schizophrenic patients who have had dissociative disorders ruled out. This would be very beneficial as studying the minute differences between DID and schizophrenic patients would be able to enable psychologists to be able to see the differences and tell between these two disorders more clearly. Another proposal is that the DSM criteria take these findings into account, that DID has several positive symptoms of schizophrenia, and in regard to that, making negative symptoms rated more strongly for schizophrenia to be a diagnosis. A possible addition of a dissociative subtype of schizophrenia has also been proposed to explain the overlap in these symptoms. A possible current solution for this problem also exists, in the form of the structured clinical interview for DSM-4, the fourth revision of the DSM, dissociative disorders. In one study, this interview revealed that patients with DID receive higher scores in the interview than schizophrenics. Due to this, the interview could be very useful in giving correct diagnoses to patients, as it has been shown to be able to distinguish between DID and schizophrenia. DID and schizophrenia remain two distinct disorders. The symptom overlap between the two cannot and should not be ignored, as it may lead to misdiagnosis. However, there are also distinct differences in the areas in which these two mental disorders overlap, and those should also be considered as well. Further research on these mental conditions will give patients the care they need and prevent more misdiagnoses in the future. These are the references that were used for this presentation. Thank you for watching, and I hope you enjoyed this presentation.